Alright, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and we are here end of day, nearing the end of day, doing one of our bigger laser acne scar combination treatments and also rejuvenation. She's a younger female, very beautiful, but has some scarring that she wants to be less noticeable. So we did first our filler, now we are working with our favorite microneedling radiofrequency device, Pixel 8. This device has very aggressive deep needles that can be tailored to any of the issues that we're looking to improve, like texture, color, and tone. You guys can see we're focused on this area I've circled, but I'm working on her entire lower cheek area because that's where she has most of the scarring, and the lateral cheek area as well. And these needles, you see, they're gold plated, and they have, what'd you say? You can see they're gold plated and they puncture into the skin. We're actually going to do 2 passes here today. So I want her to get the best result possible.
How much does this procedure run for? It really depends on the areas, what we're doing it with. Are we doing the cheeks? Are we doing full face? Are we doing face, neck? Are we doing other areas? Are we doing it with laser? For the best information, send us a DM, full name, email, phone number. We'll reach out to you and get you accurate info.
And I'm working with multiple levels, which is what I like. We can go to various depths, you guys, in different settings, allowing us to do different things, whether it's the texture, whether it's tightening, whether it's pore reduction and rejuvenation or not. She had one little scar that we noticed on her chin, so we're going to focus on that as well. And our focus is to get as much improvement as we can. Now, if she did this alone, very, very minimal downtime. It wouldn't need any nerve blocks like I'm doing now.
How much is a consultation? It depends on who you're doing it with. Dr. Emer is going to be $500. You can come see our treatment coordinators in the office for less cost, or you could do a virtual consultation. We have different prices for that. Send us a DM, full name, email, phone number. We'll get you set up with the right consultation.
So now we're going to do this side. Same thing. And so basically I've marked all the areas because I'm focusing on doing a little bit stronger through those areas. So the whole area, not the forehead. And you guys see we've marked all the scars, so I'm going a little more dense in those areas and really focusing on the areas that I've marked. I want her to get the best possible. You guys know when we combine lasers with microneedling radiofrequency, what do we call that, Jordan?
Tight and bright.
Tight and bright, which is really what this is. But in this instance, we're going to focus a little bit more on her texture and scarring rather than pigmentation. That's our goal. You turn you to the right a little bit. Perfect. And so for those providers out there, one of the things you can actually do to
With Dr. Emer,
results. Yeah.
What do we like to apply after this that we have in stock?
Well, that's what I was going to say is one of the things you as a provider, if you want to apply my illuminating mask, we could apply it tonight and actually get a more quick recovery and an even better result. It has retinol, TCA, lactic acid, glycolic acid, kojic acid, and it's arbutin. It's anti-inflammatory and helps healing. I would want her to do that actually every week for the next few weeks after healing. We are going to do something though special immediately after this and apply what?
Why is the periorbital area so swollen? That's because of our nerve blocks.
Exactly. We're going to apply healing agents such as exosome therapies, and we will show you guys that in a minute because the results will be more quicker healing and an even better result. Now we're going to do our second pass.
How much does this usually cost? Depends on the areas and what combo we're doing. For some pricing, send us a DM, full name, email, and phone number.
Doing really good. So these acne scar combinations really get a lot of improvement, much more than doing a single thing alone. You just depends on what scars you have and what we can do. Could we go a little stronger? Yeah, if we wanted to do ablative laser, we could. But this is a good start for her. A lot of the scars need filler, which we already did. And adding this microneedling RF is really going to help her end result, which is smoother scars and less pores.
What are y'all doing to her? We are doing an acne scar combination. Right now we're doing our Pixelate RF. This is microneedle with radio frequency from ROHRER Aesthetics. We're doing it over her cheeks in multiple passes so that we get the most improvement for her. She is getting ready for a wedding, so we have to make sure she looks great.
Oh my god, yes we do. That's the key. I always like when people send me their wedding photos afterwards. I have a couple of my patients recently that did some headshots. They sent me those. I was super excited about that. Just happy to see people self-confident and feeling good about their skin. That's what we care about. So look at, not too bad. If you did this alone, it wouldn't be much downtime, but adding the laser is really gonna help her get more ultimate results. So you guys can see Pixelate, one of my favorite microneedling RF devices. Now we're gonna start our laser. Perfect. Numbing on that.